So in health optimization, there are some key things we want to target, and one of those is MTOR, the mechanistic target of rapamycin. And MTOR is this little signaling system basically that upregulates, gets turned up in the presence of protein, and in particular branched chain amino acids, some of the very specific building blocks of protein. And if you think way back in the caveman day, in certain seasons of the year, there was plenty of meat around that they could hunt and they bring back, and the meat was abundant. And as they ate that, the body responded by upregulating mTOR, and they grew muscles and they grew taller, and the body started to build. But then in winter, there weren't many animals around and food became more scarce, and therefore mTOR would have been down-regulated because of the less amount of protein and branched chain amino acids that they had access to, and the body just started to then clean up itself. It started to use autophagy. You became a bit catabolic, and it broke down those senescent cells. And so you want to sometimes upregulate mTOR to grow, and then sometimes you want to downregulate mTOR in order to get the body to go around and clean up anything that's old and doesn't work so well anymore. You can do that through a whole bunch of strategies. There are molecules out there, supplements that you can take that help to control mTOR, or you can just do things like intermittent fasting. A 16/8 fast overnight will help to suppress that mTOR, or even just reduce the amount of red meat that you're consuming in a week, and that does also help to turn down mTOR.